You just need to ask questions. I mean, more than anything else, you want to ask your pharmacist, ask your doctor. You know, you don't necessarily want to look everything up on the internet, and you want to ask questions and have conversations more than anything, because it is confusing, and even cold medication, there's 50 different kinds to choose from. The best thing and the most important thing anybody can do, whether you're on one medication or on 10 medications, is carry the list of the medications with you. And we have different toolkits and different lists that you can have. There's a lot of different resources out there, but just carrying the names of the medications and the doses that you're on is very important. Also, just a matter of knowing your medication and being able to pronounce the names is helpful, because there's a lot of look-alike, sound-alike medications out there. Real common one is Zantac and Xanax. Xanax is used for anxiety and things like that. Zantac you can actually buy over the counter, so there could be a lot of confusion about that. If you're for some reason in distress, or if there's in case of an emergency, you want to be able to communicate that. You need to keep everybody informed of what's going on. So if you go to one doctor, you need to take your medication list in and let them know what you're taking. If you go to another doctor, if you're referred to another doctor, even your dentist, you need to let everybody know what medications you're on or what over-the-counter medications you're on, just so everybody's informed and everybody can make an informed decision at that point as far as their advice for you. A lot of times there's interactions that you may not be aware of, even with over-the-counter medications. It's really important to use one pharmacy team to fill your prescriptions. There's a lot of systems built into place, not only in the computer systems, but just knowing the people, seeing the same people every day. If you go to a retail chain, you want to go to a retail chain that has those systems in place that check for interactions. They check for high doses, low doses, doses that might be subtherapeutic at that point. Pharmacist is definitely part of the healthcare team. You can call your pharmacy, there's always a pharmacist on call. So, you have any questions, any advice, we work with the doctors and the nurses and everybody trying to get the best outcome for the patient.